Good morning, everyone. Father Kevin here. Um, it's the Feast of St. James today. It's 25th of July, and we're looking at 5 months till Christmas, just so everyone can get that on their calendar. So some parishioners have asked, and we thought it was time to give you kind of an update of what's going on with me in terms of my health. So first of all, I want to thank you for all your prayers and all your the masses that you've offered for me, and the different ways that you've supported me over the last few months. It's been really helpful for me as a priest, as your pastor, as your friend, to know that I have this support and this love from all of you. So thanks for all of that, first of all. And I would request that you help me by continuing to do that, because I believe that prayer is so powerful and can help us in coming to know the Lord's will for us as we go forward. So thank you for that, and please keep your prayers going for me. Thank you. Just a couple things to talk about. First of all, my symptoms haven't really changed all that much. My vision is a little bit more compromised than it had been. So you'll see me at Mass wearing a piece of tape over the lens of my glasses, or you might see me at Bible study wearing a piece of tape on the lens of my glasses. So in like a normal conversation with somebody, I don't really need any help. But when I'm dealing with a larger group in a large setting, I have double vision, and so it creates problems for me and headaches for me and different kinds of things like that. So you will see me with that piece of tape on my eyeglasses from time to time, and so just be aware that that's what's going on here. The other symptom that I have has to do with the nerves in my face and around my mouth and my forehead and so on. But it's not compromising, it's not difficult. It's just a factor because of the nerve blockage, because of the tumor. So we don't know what's going to happen over the next few months or years or whatever. There's just no way of telling. Symptoms may increase, they may not increase. Something else may develop. It's just all unknown right now. Kind of like our lives are always in the Lord's hands. So this disease is also in the Lord's hands, and we'll see what He has in store. I did want to alert you to the fact that I've had some continual medical consults and conversations with doctors and healthcare professionals about this. Everything kind of stands the same way I talked about it the last time to you. There's no real change in the prognosis or the diagnosis. But it was recommended to me that I seek radiation and chemotherapy to maybe alleviate some of the symptoms and maybe to kind of temporarily halt the growth of the tumor at my brainstem. So consulting with people, staff, friends, doctors, I'm thinking I'm going to go ahead with that, and we've arranged to begin chemotherapy and radiation on this coming Monday, the 27th. So I will be in 5 days a week receiving radiation therapy, and it's a brief kind of thing. Just have to go to the hospital for, maybe 15 minutes or so to do that. It's about 30 sessions, so about 6 weeks, Monday to Friday, about 6 weeks of that. At the same time, I'll be taking a moderate dosage of a chemotherapy pill. And so I'll be taking that each day as well, but that's every day for 6 weeks. So those are the things that are going to be coming up for me starting next week. Symptoms are difficult, or side effects are difficult to kind of gauge. oftentimes people feel tiredness and people feel maybe some digestive issues. And so we'll see, how my body responds to this treatment and what it's going to ask of me. I may have to take some more time off during this period just to kind of deal with the side effects or so on, but I don't know that. So what we've done is I've contacted Father Jim Koenigsfeld, and the former pastor, and he's available to help me out during this time. So he'll be starting to do the Tuesday masses for me. And then if I am incapable of really functioning on a weekend, he'll step in and take over the masses for me. Actually, it was recommended by my doctor that I just simply attend the masses and let him take care of leading and presiding the whole thing. But I don't know where that's going to be right now, so we're going to gauge it as we go. So as a result of the chemo and the radiation, my immune system will be compromised, and therefore I will be very much more vulnerable to disease or other kinds of issues. And so I'm going to have to reduce my contact with people and my availability to events and things like that, just so that I can stay safe, since my immune system will be kind of broken down a little. So just be aware of that. Probably not as many opportunities for me to have appointments, or we'll see how Bible study goes and Brothers Bound in Christ and how those things work for me. So a lot of it is right now unknown, and we're going to do our best to manage and to try to keep as active as I can. But I thought it would be good for you to know what's going on for the next 6 weeks. So that puts me around the end of the first week of September, and then I'll be taking a break from any treatment, and then after a little bit I'll be going back onto the chemo, but the radiation piece will be done. So that's what's happening with my health, and again, thank you for your concern, and we trust in Jesus to help bring us healing and wholeness on every level. And I, again, thank you for your prayers.